We're joined in this portion of our program on the Fan, WFAN 101.9, and of course on the Odyssey app on Sunday mornings. Morning, everybody. I'm Bob Salter. It's nice to have you join us on our program today. Hopefully, this Thanksgiving holiday weekend has been a good and safe one for you and yours. We always do like you to join us in discussions here. And we're good discussion, an important one and a timely one too, with guest who has spoken with us once previously on the program. His name is Dean Fanelli, Dr. Dean Fanelli, that's with the PhD, is a patent, regulatory, and transactional attorney in Washington, D.C. office of Cooley LLP on the web, by the way, at Cooley, COOLEY.com. And he is joining us to talk with us about some of the things that we've been hearing about in the news with this latest variant of COVID-19. Dr. Dean, in the work with the law firm that he works with, is focused on issues related to the development, protection, and commercialization of biotech and pharmaceutical products. He's also, in his background, co-founded 3 biotechnology companies. He's a board member of the Children's Charity Foundation, which is a Washington, D.C. based nonprofit that's aimed at assisting children in the Washington, D.C. area. He's also a volunteer baseball coach for the Davidson, Maryland Athletic Association. Keep yourself busy. Nice to have you join us again on our program.
It's my pleasure. Thank you for having me.
A little bit of background in our discussion on a couple of different things, because I mentioned these, and sometimes people are curious about guests, the perspective they bring to discussions too. I mentioned in kind of trying to give an overview of the type of work that you're involved in. How does it relate to development, protection, commercialization of what have come to be known as biotech and pharmaceutical products?
Yeah, thank you for asking that. So I started my background in science, actually. I got my PhD in organic chemistry, and then I switched over to law. And because of my technical background, I was focusing a lot with on patent-related issues, initially with chemical, pharmaceutical, and biotech companies. And oftentimes, when we talk about emerging growth or early stage companies, which are the type of companies that I work primarily with, these are companies that their primary asset is or are their patents or their intellectual property. It takes, as we know, many years to develop a drug. So oftentimes, what I do is I assist companies at a very early stage in filing patent applications to protect compounds and biologics and pharmaceutical products that are, they don't even know if they will lead to an actual approved or authorized drug, but they're very early stage. And oftentimes, as they're moving along, obviously there's issues with FDA that I assist companies with, how to interact with FDA for the approval of their products. And oftentimes, emerging growth companies often will undergo transactions with larger pharmaceutical companies, whether it's for manufacturing, co-development, collaborative agreements. So that's how I work with companies, as I mentioned, early stage companies, obtaining patents, protecting their early assets, assisting with FDA regulatory approval, and then transactional work with larger partners and potential collaborators.
What was the experience like in the co-founding of the 3 companies I mentioned earlier?
Yeah, so when we see these very early stage assets, oftentimes, as I mentioned, these are early stage companies. Many times they don't have funding yet. So we identified some technology from scientists that we're working with at universities. One of the companies, the first company I founded, Phasimune, it was a neoantigen company that we were developing basically cancer vaccines, and the company was sold to a Boston-based publicly traded company called Agenus, and they're bringing that technology forward. But basically, what that technology involved was there was these phosphopeptides, or basically a small amino acid chain with a phosphate group that were attached to cancer cells. And these were indicative to cancer cells. So the same way when we think about that spike protein and the vaccines that target that spike protein for coronavirus, the thought there was, okay, these phosphopeptides that are attached to cancer cells are indicative of cancer cells. So if we can take one of those off and have the body basically generate an immune response, you can effectively have a cancer vaccine that would fight particular types of cancer. So similarly, another company, C-Reveal, is a precision oncology company that's taking a similar approach, focusing on inhibiting a certain peptide that is that cancer cells use to hide basically from the immune system. And our most recent company, Mrna Therapeutics, that's actually a lipid nanoparticle, which is the delivery technology for the mRNA vaccines. That company is actually developing new mRNA vaccines that some of these side effects that we often hear about, those 24 to 48 hours of fatigue and flu-like symptoms after you get that second shot for certain people, we believe we found a way to obviate those side effects so that people, when they get that second shot, they wouldn't have side effects or such serious side effects. So it may incentivize additional people to get vaccinated and also have increased, potentially increase the way these are made, so they become a little more efficient to make them.
Now, I didn't mention in introducing you that you also are involved in hosting a podcast, Politics and Life Sciences Radio. How do you describe what that's all about?
Yeah, I started that podcast about a month or so after, or a couple months after the pandemic started. Basically, I heard so much misinformation out there, and a lot of people, they're just fundamental issues in science that people, probably may have only had a high school science class or maybe one or two college science classes. And just hearing a lot of the way the media described things, and most importantly, the politicization of, different types of treatments, different types of therapeutics that were available, particularly like hydroxychloroquine. There was so much misinformation out there that I just wanted to kind of do my part. So I started that just to provide very fact-based information about the virus, about the vaccines, about the therapeutics that are being developed. And we have guests on that just talk about those issues. So we keep it very, as I mentioned, fact-based to allow people to sort through some of that misinformation that's out there.
How do people listen?
We're online at our iHeartRadio. If they Google Politics and Life Science, they'll find our website, and they can listen there.
Okay. Now, let's get into talking about a number of things that surround this whole COVID story that we've been involved in realistically on a elevated basis since March of 2020. And we get into a discussion that often comes up with this question. Is there actually a difference between a booster and the COVID-19 vaccine?
Yes. So the vaccines itself, they're given to generate that immune response. Most people, if you think about the mRNA vaccines, there was 2 shots. For Pfizer, you get that first shot, then you would get your second shot 3 weeks later. For Moderna, it would be 4 weeks later. And J&J obviously was a single shot vaccine in the US. The booster shot, and there's another term people probably heard is third shot or third dose. And that's also a separate thing. The third dose was basically for a small cohort of people we've heard people that were immunocompromised, or particularly people that had organ transplants who are on immunosuppressants that would obviously suppress the immune system so the body wouldn't reject that organ, while they weren't generating a strong enough immune response. So that group of people and some other people similarly that weren't generating an immune response would get a third dose of the vaccine. And those doses were just to provide, similar to vaccines we give our children when they're young, to prevent them from, if they were to come in contact with the virus, from having the severe symptoms, basically the hospitalizations, and of course, preventing death. We know the mRNA vaccines were very effective. I was shocked at how effective they were, but in a good way, of course. And they also, for some of the initial strains and initial variants were out there, also prevented transmission. Now, the booster shot, it's the same vaccine, so it's not as if you're getting something different. But what that does is your body the immunity tends to wane. And we have to keep that in perspective, because we have to remember what the vaccines were initially meant to do. They're meant to keep you out of the hospital, and they're meant to prevent you from dying. Now, we were, as I mentioned, very fortunate that the mRNA vaccines actually prevented even asymptomatic transmission. They prevented even the mild symptoms. But the main goal of the vaccines was to prevent moderate and severe disease. And after a period of time, your body's immunity would tend to wane a little bit. So you needed to boost that immunity. And that's the effect of the booster shot. It basically, as your immunity starts to wane, it gives you that extra boost. And, as we hear about these new variants that come out, it's going to be pretty much, I think, in the science community, it's pretty much well accepted at this point that everyone's ultimately going to need a booster shot, because the immunity does tend to wane.
Any age restrictions on the boosters?
At this point, so when the boosters first came out, they were for people over 65,
Right.
and people that were at risk. At this point, the CDC and FDA are saying boosters should be given to everyone that's over the age of, for Pfizer, 16, for Moderna and Johnson & Johnson, over 18. The boosters aren't authorized for children yet, but they are for adults.
Another question has come up for people who have tested positive for COVID-19. How long can those people spread COVID-19 after testing positive?
Yeah, that's a very important question. And I think, when we think back to last March, a lot of people put a lot of pressure on Dr. Fauci when he said, about not wearing masks, because we wanted to keep masks available to our medical professionals. And at that time, we didn't even realize about asymptomatic transmission. So that was a key. And that's why, we all have to wear these masks even after you're vaccinated. But to answer your question, after you can still spread the virus, you can still, even if you're vaccinated and you become infected, and the period of time that you could spread really varies amongst people. And it tends to depend on the severity of disease in the individual. When you think about the virus, it's replicating. Once you become infected, it replicates in your body, and you start to shed that, meaning you start to spread it out of your nose and mouth. And depending on the individual, so it's not a set period with, for example, 2 days or 10 days. It could be anywhere from 10 to 30 days, give or take, where you can be infected, you can be contagious, or you can feel like you've gotten over it, but you can still spread the disease. So after you get over it, typically it's about 10 or so days till you're safe and you wouldn't spread it to other people, but it does vary.
Very interesting discussion that we're having on our program this morning, joined by Dr. Dean Fanelli. Dr. Fanelli, and that's with a PhD, is a patent, regulatory, and transactional attorney in the Washington, D.C. office of Cooley LLP, on web at Cooley, COOLEY.com. And he's kind enough to be joining us on our program today. I'm Bob Salter. Let me ask you a question about the vaccine trials, the COVID-19 vaccine trials, because I've always been interested in this. And I think it's a natural question a lot of us probably wonder. Are volunteers actually compensated for being part of those trials?
People are compensated when you're in a clinical trial. It's a small amount of money, depending. on the type of clinical trial you're involved in. It could be anywhere from $50 to a couple $100 a day. And it really depends on the type of clinical trial, how invasive the clinical trial is. If you're staying overnight in a hospital, obviously all your expenses would be paid. So the answer is yes, they are paid, but it's not an amount that would incentivize people to say, hey, I want to be a clinical trial participant. It's more, a menial amount to pay you for your costs of participating, and just a little bit extra. So they are paid, yes.
And if one is part of a vaccine trial, do the study results get shared with the participants?
So everyone's probably heard of these term double-blinded study,
Right.
which means half the people in the trial will get a placebo, half the people will actually get the experimental drug. And blinded means neither the clinician or the person that's administering the medicine or placebo or the patient knows. So during the trial, no one would know any results. Certainly if you were pulled from a trial, they may explain why you were pulled from a trial. Another reason would be in certain instances, the drug or the vaccine candidate performs so well that they shut the trial down sooner. Or what they'll do is, instead of giving people placebo, they'll actually give them the candidate, just because it would be unethical when you're talking about a treatment that works so well. But generally speaking, not until the data is analyzed and not until the results of the trial are published would the participants know any results. So they're not advised at any time during the study of what's going on or how any other individuals or the effects that any other individuals would have during the trial. It's only after the results, and they're also confidential.
Okay. I think these are natural questions that come up. And of course, the timely nature of our discussion surrounds the fact that there is this newly named, newly identified COVID variant. Basically, from what I've read, it seems like it's been identified in Southern Africa. It's officially designated a variant of concern by the World Health Organization. What exactly does that mean?
So when the World Health Organization and local public health officials identify a new, and the vaccines mutated thousands of times. When we talk about variants of concern, you're talking about a variant, a mutation. And basically when you say mutation, we hear these fancy words. I mentioned as the virus replicates in the body, a mutation is just a mistake in the replication, so that some of the therapeutics that are now coming out, that's how they work. They basically insert so many mistakes into the replication process that it just acts as a therapeutic by preventing the virus from replicating in the body. So when we talk about variants of concern are variants that have a mutation, particularly on that spike protein, and they basically, they're a concern to public health. Either they mean the current vaccines won't work as well or won't work as all, or in some way they put the public at a higher risk than the current basically strain of the virus that's circulating. So it's more of a public health issue, and they give that label very early. When they see it initially, it would be called a variant of interest, and then as it becomes more concerning, it would be a variant of concern. And certainly with this new Omicron strain, that's where we are now, a variant of concern because of the level of mutations, particularly in the spike protein.
Mm. And the reports, some of them talk about this idea that there seems to be a surge of infections in South Africa, but there's cases of Omicron that have been detected, I believe, in not only South Africa, but Botswana, Israel, Belgium, Hong Kong. I guess the question naturally comes up. when people hear this sort of thing. What should we do? I mean, obviously, you don't want to induce panic on the part of people. And in a way, it would seem to be only a natural reaction after what we've been through since March of 2020.
Yeah, certainly, hearing this news, a lot of people were probably very frustrated and a little anxious about this. But I think, we've learned a lot about the virus over the last couple of years. We learned a lot about, and the public has become a lot more educated on individual public health and what we can do. And there are things we can do as individuals. I mean, certainly getting vaccinated, it could be an issue where at some point we have a variant that basically evades the vaccines. I would suspect this Omicron, the current vaccines would be somewhat effective, but maybe the efficacy goes or effectiveness goes down. And, that may prompt people to go out and get boosters. But I think the initial thing people should do, certainly, when we think about, how do these variants keep popping up? Well, basically, as I mentioned, when the virus enters the body, it replicates. And as it's replicating, mistakes occur. And, some of these mistakes make the virus so different that the current vaccines that focus on that spike protein can't recognize it. And if you think about it in terms of, it'd basically be, if I was walking down the street with a hat on and you could see my face, the hat you have to look a little closer. But if you think about, in the winter, if I'm walking down and I have a ski mask on my face, it'd be a little more difficult to see me. And in a similar way, that's the way the vaccines are working. If they can identify the antigen, in this case, the virus, they'll attack it. But as the mutations occur, the antibodies in our body, and they're very effective. So I'm simplifying this drastically. If the mutations occur to such an extent that the antibodies in our body and our immune system don't recognize it, we have to mount a new response, and that allows the virus to continue to replicate. So point being is people who are not vaccinated, that is really what's driving the continued development and continued mutations, and ultimately these variants of concern arise because the people who aren't vaccinated, this is replicating in their bodies and mutating, and ultimately, this happens billions of times. You're going to get a variant that potentially has less efficacy. And if we think about, why does this keep coming out of South Africa? Because, one of the other variants also came out of South Africa. When we think about sub-Saharan Africa, that's one of the least vaccinated places on the planet. I mean, we've done a very good job globally of vaccinating people, but there's still a lot of work to do. And, when we think about how do we get through this, it really is going to take a global effort. So I think, the question or the answer that I would say is, people shouldn't be scared of this, but we should be diligent. I think at this point, voluntarily wearing your mask if you're in crowded places, that's probably a good idea. Certainly if you're not vaccinated, I don't want to tell people what to do, but I would suggest people educate themselves. There's been over 7 billion doses of the vaccine administered, of the various vaccines administered globally. So these are very, very safe. They're very effective. And a lot of the information out there that people are using, this was developed too quickly. There weren't trials. There certainly were trials. Any vaccine, even a vaccine that comes out for this new Omicron, if need be, variant, would have to go through trials. The FDA and these companies are just working very quickly, but they are doing trials. So I think acting appropriately, if this turns out to be more contagious than Delta, or more transmissible than Delta, certainly, wear your mask, keep that social distance. There are little things we can do that actually do work.
One of the realities is that there are people who, this might sound silly to use this term, but it's almost like they have COVID fatigue. This, a lot of people who just, for whatever reason, are over this. Okay. And is that an area of concern that people just may not take this as seriously and, you know, come out with lines like, well, you know, I'll just take my chances.
I think that's a very real concern. And I think public health officials are extraordinarily concerned about that. I mean, I could tell you, you know, I'll speak for myself. I'm very fatigued over this. I was very frustrated when I heard about this new Omicron variant. And I was actually surprised at how quickly, you know, after Delta, that we're now talking about another potential variant that's even more transmissible. But I think there is a very strong likelihood and concern that people are just going to throw their hands up and say, look, you know, you told me to get vaccinated, I got vaccinated. You told me to get a booster, I got a booster. You told me to wear my mask, I wear my mask. And now you're telling me we basically, if this turns out that it is as serious as some of these preliminary actions make it seem, I think you are going to hear people, you know, being very frustrated and, you know, not wanting to kind of continue to take the actions that are necessary. And I think that would be a big mistake. I hope people just hang in there. You know, we saw how Delta kind of came around within 6 months. You know, we understood it and we were able to live with it. I suspect the same thing. If this is as serious as it sounds, you know, we'll just have to get used to it and just have to act responsibly. And I hope people understand that, you know, this is a global pandemic. We're probably going to continue to see variants pop up. But we just have to, you know, protect ourselves and our families and just act responsibly.
Well, let's go on that last point of, you know, probably going to see variants pop up. A natural question, I think, on the part of some of the people who are listening to this discussion today is, well, how many of these things are in our future, or does anybody have any clue?
I think we do. Honestly, I think we don't have any clue. But I think what we can say is, as long as we're in this pandemic situation and we're not in an endemic, meaning, you know, we have it basically it exists, but we have it under control. We're going to continue to see this, and I think what that should incentivize people. You know, if people are complaining about it, as I mentioned, this is really, if you're vaccinated, that's the best way to kind of get us out of this. Now, certainly, you know, we're a globalized world. People fly all over the place. We've already heard about how the new variant has appeared in Europe and Asia and South Africa. And, you know, there's probably a likelihood that it's already in the US. But I don't think anyone can say for certain, you know, how many variants will pop up or how many variants of concern will pop up, especially not knowing, you know, how long it's going to take to get this under control. Because certainly, you know, if you think about having to globally vaccinate, you know, billions of people and, you know, in many cases give them 2 shots, you know, to have to, you know, then go back, and if the efficacy of the viruses is much lower for this new variant, to have to go back and then start over again, you know, you could see how this could take time. And the longer time we're in this pandemic situation where it's out of control, we're likely going to continue to see these variants, unfortunately, pop up.
Well, I believe it was Moderna which had announced, I guess it was on Friday, that there were plans to develop basically a booster shot to try to handle this new variant. You know, are we likely to see that sort of thing on the part of the other major players in this?
I think we'll have to see how this plays out. Now, certainly, all of the companies that have vaccines out are looking at this very closely. I think, if I recall correctly, I read an article that said they can probably have a new vaccine that would be effective against a new variant within 100 days. And that's talking about the mRNA vaccines, which are generally quicker to make. So I think they're all focusing on there. We know Moderna was one of the most effective vaccines out there. So certainly that they have the expertise. mRNA is what they're all about. So if anyone can kind of get this going very quickly, it would be Moderna. But I think all the companies definitely are looking at this. They're all thinking about how to tackle this. And to the extent, once we learn if this truly is more transmissible, more contagious, and Hopefully, the mortality is not higher, but if that's certainly the case, then we will need a booster that targeted specifically this variant.
Amazing situation we're watching as it is developing. Very timely discussion with Dr. Dean Fanelli. Dr. Fanelli, and that's with the PhD, is a patent, regulatory, and transactional attorney in the Washington, D.C. office of Cooley LLP, on the web, by the way, at Cooley, COOLEY.com. And he's kind enough to be talking with us on our program. I'm Bob Salter. One of the thoughts I had heading into this discussion today, in a way, gets into this bigger discussion about vaccinations, because the Centers for Disease Control, I believe, said it's basically close to 60% of the US population has been vaccinated. And one of the questions that comes up, and I'll put this to you now, this idea of compulsory vaccinations for the rest of the population, do you think they're necessary?
I hate telling people what to do. I think that's one of our problems in this country. A lot of people took the advice to get vaccinated as an order to get vaccinated. So I'll answer that in two ways. The first is, can the government do that? Is the government able to basically mandate a vaccine? And the state governments can. It's in their public health. It's in their authority to basically tell their citizens that they should get a vaccine and they need to get a vaccine and require them to. Now, the second question, should they do it? That's a much more difficult question. I mean, we've heard all the issues of autonomy and, individual rights. My opinion is if we did require it, that would get us through this quicker. I mean, I think, employer mandates, vaccine mandates have shown to increase the percentages of people that have been vaccinated. It sounds obvious, but there's a large percentage of the country that dug their heels in and just does not want to get vaccinated. So certainly, if there was a vaccine mandate, going back to our earlier discussion, we'd get through this a lot quicker. But I think it has to be a more comprehensive plan, because when you think about, and I don't want to go off on a tangent, but you look at issues of our borders. A lot of doctors said, this stopping travel, or so the U.S. will stop travel from certain countries starting on Monday. I've heard several doctors say we should stop today, and I think logistically it wasn't possible to do that. I think we've heard about we're now vaccinating people at the border who are coming across the border. So I think if you're going to have a mandate to require people to do that, I think, people are going to want to see that we're taking it seriously, and, the border, cases aren't getting in that way. We're taking it seriously through the FAA, and people aren't entering the country, unless we're sure that either they're vaccinated or they're negative. So it's a really difficult question. I would not want to be a politician having to make that decision, because it just seems like it's such a lightning rod whenever anyone says employer mandate, government mandate. People just really get very upset. But nonetheless, at least my opinion is, mandates do work. We don't like them. We don't like being told what to do, but that's a way that's going to get us through this quicker than it seems to be taking.
What has your reaction been, or do you have a reaction to the move on, as I understand, on the part of Austria, which basically has become the first country in Europe to make COVID-19 vaccinations compulsory?
I think the Europeans have a much different situation. I mean, with their borders, and they have a lot of people coming in through the borders. I think it probably was a good idea to do that. And I think, if this turns out that it's a variant of concern that has a higher transmissibility, I think we will start to see more countries do that. I think it's a little more acceptable in Europe than it would be here, because Europeans tend to take a more communal approach to things, unlike Americans who take a more autonomous kind of view of things. So I think it would be easier to have that type of implementation of a mandate and requirement in European countries than it would here. But generally speaking, we are seeing cases go up. We still don't have this under control. Even in the U.S., we're seeing about 1,000 deaths a day. We know the number of hospitalizations are over 80,000 people a day. And it was even worse in some European countries that are seeing surges. So I think in Austria was probably the right thing to do. And I think we will see that in other European countries. And really, depending on how this Omicron, or if there's another variant that's even more transmissible, I think we'll probably likely at some point see that in the US if we don't get this under control and we continue to see these variants, because it's affecting the economy, it's affecting people's lives. And at some point we just have to say, what are we going to do? We all have to do our part to get through this. And you can't just have people out there that are just refusing to do it just for the sake of refusing. Certainly if you're allergic to the vaccines, you don't have to get the vaccine. But if you're healthy and you're able to get it, people need to do their part, I think, at this point. And my view actually has changed on that. I was originally a more, self-autonomy. People should make their own decision. But, coming up on 2 years into this coming March, it's getting a little frustrating for everyone. And I think, a lot of people, we know, as I mentioned, billions of doses of the vaccines have been administered. So we know they're very safe, they're very effective. So a lot of the early stage arguments of, this is too new, that it's not safe, they didn't study the data close enough, I don't really think they hold water anymore. So I think it probably is the right decision that Austria's chancellor made.
Earlier in November, Center for Disease Control acknowledged that basically it's almost 150 million people have been infected by the SARS-CoV-2 virus and have survived it. Something we really don't hear an awful lot about. Two-part question. The first part deals with the fact that we don't hear that much about it. And maybe a thought or two on your part on that. And then the second part is in this area of, we hear this term used, of herd immunity. And realistically, can that actually be achieved on an individual basis naturally and or with a vaccine?
Yeah, so to the first question about why don't we hear about this, I don't know why we're not hearing about it. I suspect we're not hearing about it because people that get the virus naturally will have natural immunity, and there have been studies that show natural immunity provides very strong immune response and very strong immunity. So I think we haven't heard as much about it, probably because we're trying to encourage people to get vaccinated. Another reason is the diagnostic testing has never been where it needs to be early on. So I think a lot of people that were infected just didn't even know they were infected because the diagnostics were just not immediately available in the US. But ultimately, I think the government's trying, and governments around the world are trying to encourage people to get vaccinated so they could keep track of who's vaccinated. If we just say, okay, if you've got natural immunity, you don't need to get vaccinated, all these people out there that are skeptics probably would start raising their hand and say, okay, I'm naturally immune. So I think it's been more of a question of, let's not even go down that path because it'll just be too hard to control who has been vaccinated, who's not been vaccinated, who has immunity, who doesn't. But the issue of herd immunity is really not an individual issue. It's more of a statistical issue for, are enough people vaccinated to prevent the spread? So if you think about it, if I'm in a room with 200 people and no one's vaccinated and one person's infected, it's likely a lot more people are going to get infected. If I'm in a room with 200 people and someone walks in that's infected and 180 of those 90% of those people are vaccinated, it's less likely, obviously, the people that are vaccinated to have a breakthrough infection, although we know that they do happen in some instances. And it would be statistically less likely for those people, those 20 unvaccinated people, to become in contact with that single individual. So herd immunity is basically, we've heard a lot about it initially. We don't tend to hear that much about it anymore. In the US early on, we heard it could be anywhere from 70 to 90%. At this point, I think, the US really hasn't gotten near herd immunity. I think it's just been very difficult to get people vaccinated. I mean, we have, whatever the number is, below 70% of the population vaccinated. We're obviously not at herd immunity. We still know this is spreading throughout the country. So the level for herd immunity is probably, closer to 90%, and we're just nowhere near there. And it took so long to get us to where we are now. I think the reality is, to get to herd immunity is probably, going to take a lot more people to get vaccinated. And, the focus has just been on how do we keep control of this, rather than how, I think that was more to encourage people. Hey, if enough people get vaccinated, we'll get through this. But that message didn't seem to work as well with certain people in this country.
Here we are, we're moving pretty rapidly toward the end of 2021. If we look ahead and pick a date of March of 2022, where do you hope we will be with regard to this pandemic?
Well, it's funny, because if you asked me that question about a month ago, I would say hopefully, we're through Delta. Enough people have either been infected and have natural immunity or have been vaccinated to protect them. Now with this new variant coming out, I just hope we're still seeing about 1,000 people a day die. We're still, as I mentioned, seeing about 80,000 hospitalizations per day, which is, to put that in perspective, the FDA said normal would be, to get back to normal, we should be under 10,000 a day. So that we're well past, where we need to be normal. So, I just hope we're in a situation where people, can responsibly act. People are protecting themselves. We're healthy, and these numbers just really start to drive down. I mean, I think, in March, we're probably going to see the numbers go up over the next few weeks and months, because we're obviously indoors. It's getting colder in the US, and it's flu season. So, it's similar to respiratory virus. So we should see cases likely go up over the next month. So I hope come March, when we start to see spring in 2022, that Omicron is not more transmissible. It doesn't have a higher mortality. That we don't know yet. I hope that's the case. And I hope if it is the case, I hope people are just acting responsibly and will be willing to, either get vaccinated, get a booster if they have a booster for the new variant, or at least wear a mask if they're not vaccinated, just to protect themselves.
Very interesting information. Good information shared in our discussion as well. Dr. Dean Fanelli, that's with the PhD, is a patent, regulatory, and transactional attorney in the Washington, D.C. office of Cooley LLP. He has co-founded 3 biotechnology companies. He's a board member of the Children's Charity Foundation, Washington, D.C.-based nonprofit. And he is also he's a volunteer baseball coach, and he hosts his own podcast, which is Politics and Life Sciences Radio. And he's been our guest in our program today. First of all, thank you very much for joining us again and sharing the information that you have. Secondly, wish you the best through this holiday season. Certainly stay well, and we will consider you a resource to tap as we continue to watch this situation unfold.
It was my pleasure. Thank you for having me.